So, my name is Elisa. We're back. We're talking about the human reproductive system, the female aspect. This is part 14, the sexual cycle. It averages about 28 days and varies. It can go really short to 45 days, so a little bit longer. It's based on the regulation of hormones and a basic hierarchy of hormonal control. So, the hypothalamus is going to stimulate the nearly adjacent pituitary, which is going to signal for the ovaries to also tell the uterus to continue on in the sexual cycle and stimulate it. The hormones of the hypothalamus are going to regulate the pituitary gland, right? Pituitary over there we go with that regulating the pituitary. Okay, so the ovaries exert feedback control is what I'm trying to get to over the hypothalamus and the pituitary. So we have like brain, hypothalamus, pituitary, right? Pituitary regulating down ovaries, uterus, right? Ovaries, and then that's going to go back up until the hypothalamus. Okay, so the cycle begins with a 2-week follicular phase. So menstruation occurs in the first few days of that cycle. So after we have lost the previous egg, um, the uterus replaces the lost tissue by mitosis, and a cohort of other follicles will begin to grow as well. Ovulation is about halfway through at day 14, and the remainder of that follicle becomes the corpus luteum, and then albigans subsequent to that. The next two phases are the luteal phase. So corpus luteum is going to actually release and stimulate endometrial secretions and causes it to thicken. Should a pregnancy not happen, the endometrium itself is going to break down in the last 2 days of that, right? And it's going to be expelled during menstruation. So the menstruation begins, lasts for anywhere from 4 to 10 days, usually around 7, and then the cycle will start over. This is the female sexual cycle. So luteinizing hormone and follicle stimulating hormone are the two to watch. They're have like follicle stimulating hormone is really going to have two peaks, right? Two peaks. This is being like, this peak is actually kind of being part of, one over here. Luteinizing hormone has like one like very dramatic peak right here. So what they are going to coincide with are follicle stimulating hormone is going to stimulate a developing follicle, right? So we have these early stage follicles over here. Luteinizing hormone is going to help with 2 points right here. It's going to be raising up as the lumen itself is going to be, I'm sorry, as the follicle itself is going to be thickening, differentiating, and supporting this nascent oocyte. It really peaks high, allowing for it to burst out of the follicle itself, and then we have like this little oocyte, this little oocyte that's ready to go on and potentially become part of a new pregnancy. There's a little bit of blood sometimes that does occur, a little bit of spotting that might occur in during this phase of the female sexual cycle, during that ovulation, that egg bursting, a little bit of pain for some people actually as well, small spike in follicle stimulating hormone. It's going to reduce and kind of keep out through corpus luteum and then corpus albicans, known as involution. Here it is, involution to final corpus albicans. New primordial follicles will then prepare to begin the cycle all over again, as there is a rise now in the follicle stimulating hormone, right? So it's going to stimulate them. Okay, next up is the ovarian cycle. I hope this was helpful. I hope you're all out there somewhere having a great day. All right, bye-bye.